A group of physicians says the province should put in place a permanent ban on hydraulic fracturing or fracking, saying it presents unacceptable health risks in nearby communities, including birth defects. It could be an issue for local communities across New Brunswick if the provincial government lifts a moratorium on fracking, a controversial process for extracting shale gas. Resource estimates from the Government of New Brunswick state that 77.9 trillion cubic feet of technically recoverable natural gas exist in the province. In particular, an area known to geologists as the Moncton sub-basin has reserves of natural gas, oil, and potash. The natural gas reserves include the Stoney Creek Field, located west of the Petitcodiac River and just south of Moncton. There's also natural gas in the ground in nearby Hillsborough, according to the province. The company Southwestern Energy has exploration licenses for a wide swath of the province. When the company carried out shale gas exploration near Hillsborough First Nation in 2013, it encountered significant resistance, eventually leading to a moratorium on fracking. Shale gas is already being extracted at the McCully gas field outside Sussex. The company behind that project said in 2020 that it intended to pursue more development in the area. But a growing body of research links fracking to serious health problems, according to the Canadian Association of Physicians for the Environment, or CAPE. For more on this topic, the NB Media Co-op spoke to Dr. Renee Turcotte, a Moncton resident and retired doctor who is chair of the CAPE New Brunswick Committee. Thanks for joining the NB Media Co-op today, Dr. Turcotte. First of all, why is this issue important for you?
For me personally, even if I'm a retired doctor, I'm still a physician, a doctor, and I care for I think about my patient I had tried to help during all my career. I am concerned as a citizen. I'll be affected also, even if I don't live close to where they want to drill wells. I'm concerned about my children, my grandchildren, and all the children of the and pregnant women of New Brunswick. So it's concern for the society, concern for the the climate change, because the methane is a very, very powerful greenhouse gas. It's 84 times more powerful than CO2 over 20 years. So it affects climate change, so it affects the health of all the citizens in different ways, not just by fracking, but by the fact that it contributes to climate change. If we were going to remove the methane, we'll be well advanced in our fight against climate change.
What does the recent science show us about the health effects of fracking?
The health effect has been studied since at least they changed the fracking around 2000, maybe even about that, before that. But what we know now, there was a study done in around March, published in March, April 2024, this year. They have reviewed 52 studies, 50 or 52 studies from different counties in USA, and 2 from Canada, 1 from BC, one from Alberta, about the adverse health effect of fracking. And they arrive with very, very important facts that are very important to look at and not to disregard when we talk about fracking. And also they didn't talk about that, but the cost, the stretch on the medical, the health department, and
that's another concern.
That's another big concern, because we already are in New Brunswick, they said in the newspaper, on the edge of the abysses, and we don't want to stretch the health system more than it is now. The adverse health effect have numerous impact on the health of people, any age. Pregnant women, babies, babies to be born, older people, any age.
One of the things that jumped out at me was seeing that this has been linked, fracking has been linked to birth defects,
yes,
hasn't it? Can you talk about some of the ways that that fracking can affect newborn children?
The study, half of the studies were regarding pregnant women and babies, and they realized that a lot of them has not just birth defect, but premature birth and low birth weight, and even termination of pregnancy before the time. So premature birth is a baby born around 21 and 23 weeks. So baby are viable around 24th week. And so it has a very hard and big impact on pregnant women and their family, losing their babies.
Yes.
Or having a baby, preterm baby. Preterm baby, like I said, I didn't say that, but they're very costly to the system. 9 times more costly than a term baby, a baby born at term. And it's just the hospitalization, because we don't count all the cost and the suffering from the family, from the baby, because many preterm babies can be born with a birth defect and can develop also a lot of problems during their life. So we haven't counted, I don't know, I'm not aware of how costly it is to have a preterm born baby with problems to the society.
Yeah. Well, presumably it's even more expensive.
Oh yes, it's more expensive
than an already very expensive premature birth.
Yes, and the birth defect. There's a lot of birth defect. They have a cardiac birth defect. They have central nervous system birth defect. They have spina bifida.
Are there also specific health problems for pregnant women?
Not just pregnant women, but people living in the area close to the wells, and depending how close they are to the wells, the drilling wells, the water is affected. Right. So we found a toxic chemical in the air of the household, in the urine of the people, in their hair. They're affected like other, the chemical and the pollution affect their baby to be born, but it affect them also as a person, as adult. And the effect of pollution on adult is, in children also, asthma. We see more asthma, more hospitalization for asthma, more death from asthma, more new cases of a child developing asthma. And asthma is costly also to treat. The puffer, some of them cost over $100, and most of the people are not covered for the treatment, and it causes also hospitalization and, like I said, even death. So it's very emotionally costly also, not just financially costly, but emotionally costly for the people suffering from asthma and family having children with asthma. And that's for asthma, but it can cause also childhood leukemia, lymphoblastic leukemia, 2 to 3 times higher than people not living close to a well. Also, it can cause cardiac problem, heart failure. With older adult affected by heart failure have more hospitalization when they live close to a well than people living where there is no well. Heart failure and kidney problem also. People can have more urinary tract infection, which is very painful, and you still need to be treated. Urinary tract infection, kidney stone, which is also very painful, and you have to go to hospital, you have to need medication, surgery, treatment.
What do we know about how this happens? Does the pollution mainly travel through water?
Not just the water. There is many effect done in different steps of the fracking process. Like the beginning, the opening of the well. And there is a lot of traffic going on, a lot of truck with diesel, so that deliver a lot of particle in the air, pollution in the air, a lot of noise from the diesel, from the opening of the well, the methane that is we want to extract from the well. That's what we want to extract, the gas methane. And then they dig many kilometers vertically, and then many kilometers vertically under the water unsalted and salted water, and then a lot of horizontal digging. And then they push a lot of water, 10 million tons of water for almost for each well. And that water, it came from our water supply. Mm-hmm. And that water is mixed with sand or other product and many chemicals that 1,000 at least of these chemicals. We don't know about their toxicity, but we know about at least 14 of these chemicals that are toxic and can cause cancer, or be of the origin of cancer. So it's not just the extraction; it's all the production, all along the chain of production of the gas, and also the methane. When it's extracted, they have to transport it, and sometimes they burn the extra gas, and there is chemical in this burning, flaring, torching. I think it's called torching of these gas, and also the methane used in the household, for the stove. It's polluting the air too. Mm-hmm. So there is the pollution occur in the air, in the water, that we use in our household, in many different ways. Some people cannot use their water anymore because it's too polluted. And there is also the pond, all that polluted water that they push into the well, they have to remove it. So it's put into ponds, open air ponds, so there is also fume coming out and chemical coming out of these ponds when it doesn't leak into the water underwater and in the environment, in the earth. It's polluting from many ways.
Yes.
And many chemicals. And there is a lot that we don't even know their effect on human health.
And the NB Media Co-op has reached out to all the major political parties for their position on this issue. We'll have their responses on our website, nbmediacoop.org. Certainly the progressive conservatives under Blaine Higgs have promoted more shale development, while the Greens have called for a permanent ban. What's your group's political stance, Dr. Turcotte?
We're on a political group, so we don't favor any party, but we certainly push to ban the fracking in New Brunswick because of the consequences on the health of the population, and also because of the cost. It puts our health system is already stretched, and it will put a lot of stress on our health system if we continue again to develop that industry in New Brunswick. So it's important that all political parties banish fracking.
What does the research tell us about how fracking affects Indigenous communities?
They are very affected by that because most of the time the wells are close to their community, and it pollutes their water, it pollutes the flora, and it pollutes the fauna, and they eat, they hunt, they gather herbs. So they're very affected, and some studies have been done with Indigenous people, and their a problem with pregnancy, birth defect, and so and most of the wells are close to their area, so they are the ones that are mostly affected. People, Indigenous people living in rural area, people living in poor area.
Most of the fracking wells in North America are located near First Nations.
At least in Canada. In Canada. I don't know, in the state there is many counties where there is wells, and I don't know if they're closer to First Nations, some are in black communities, some usually are close to poor communities.
So you might say there's an environmental racism aspect to this too.
Racism and injustice, yeah.
Anything else to add before we wrap up, Dr. Turcotte?
I just want to add, people, you vote, so don't forget to go to vote. Your vote is important, and think about your health and the health of the future generation, and think about the cost of our health system. not just the cost and the health, but all the suffering caused by all these disease, all these illness caused by fracking and climate change. Not just go to vote, but ask your candidate what they think about, what are their plans for climate change, what are their plans for fracking in New Brunswick, what are their plans for climate change and the, how to fight that, how to diminish the effect, and how to, what you call mitigate, and how to adapt to climate change, because you already see the effects.
Well, thanks for joining us today, Dr. Renee Turcotte, a Moncton resident and retired physician who is chair of the Canadian Association of Physicians for the Environment's New Brunswick Committee. Thanks again.
Thank you. It was a pleasure for me.